Good evening, people. Good evening, people. Welcome to my final show of the episodes for Community Health Screen UK. It's Thursday. My name is Dr. Mekella Mehmet Yesil, and joining me live from Turkey today is Professor Saadettin Eskicorapci. Welcome on board, Professor. Welcome to the show, my final show. Are you okay?
Hello. Yeah, I'm okay. I'm very pleased to be in your show.
Thank you so much.
I'm sending greetings from lovely Istanbul.
Lovely.
And hello to everybody.
Oh, thank you for coming on the show. It's really nice to have you as our guest speaker tonight.
My pleasure. It's my pleasure.
As discussed earlier, I think we're going to be talking about urology and obviously men's health, general health, women's health. So what I'd like to do before I start with the program this evening is basically just to sort of like let our viewers know what it is that you do, how long you've been doing it, and what your profession is, and a little bit about background information about yourself, if you may, Professor.
Thank you. Yeah, I can give you. Yeah. It's my name is so hard to
Your
pronounce.
name is Eskicorapci. Yeah. So, maybe explain to our viewers what that means in English.
My original name is Saadettin, and my family name is Eskicorapci. Okay. I'm a urologist for 25 years, and I'm a urology professor since more than 7 years. And I'm lecturing in a university, in Acıbadem University, about men's health, prostate diseases, and giving lectures about the mentorship in medical faculty students. And I'm dealing with mainly robotic surgery and urological diseases. Yeah. Okay. I'm dealing with the technology, and I will talk about the new technology and the future of medicine a little bit about, and beginning with the urology also. Urology is mainly dealing with kidneys. So in men and in women, we all have kidneys. So I have many patients, not only men, but women. So we will talk about the kidney problems of the women also. But we are dealing with prostate cancers, especially. It's a big problem for men. Yeah. So
even in Turkey, it's a big problem in Turkey, is it, Professor?
Yeah, it's the second most common cancer in Turkey also.
Oh, really?
In United States and in the United Kingdom, it's the first cancer in men, as breast cancer in women. You know, it's the incidence is most common, but in Turkey it's the second. It's still a big problem after lung cancer.
Okay.
So we smoke a lot in Turkey.
Yeah, that's one of the things. And obviously, are you doing tests to find out what stages the prostate cancer is? So you're catching it early? What interventions have you created? I know you said about robotic surgery. What sort of protocols do you have in Turkey that could be different to here in the UK or in Europe for that matter?
It's basically the same, just like in United Kingdom. We use blood tests, prostate-specific antigen blood tests, and the MRIs, multi-parametric MRIs. And the finger examination, still using
the old technique,
And most men afraid of having that examination, but it still works. So sometimes we use for early detection of the prostate cancer. And after that, if we diagnose in early stages, and mostly 70% we diagnose early stages, and we mostly use surgical techniques, and I use mainly Da Vinci surgery.
Okay, yeah, I've heard of that. That's the technology we use here in the UK, Da Vinci. Yeah, it's been around for about 10 years or so.
It's good surgery, just like doing the surgery, not opening the abdomen, just from tiny holes, and with the camera, and using just like doing the surgery with PlayStation.
Non-invasive, really.
Non-invasive,
like
it's just like PlayStation. I talk about the surgery with my patients, and I explained that if you feel like, because you use PlayStation and not directly on the screen, you use some devices, and you can play PlayStation.
The control box thing.
Yeah, control from far away, not the inside the screen.
You're in the same room as your patient when you're doing this, yes?
It's not necessary. Yeah, we generally use. I am in the same room with, from medical legal point of view, we have to do that. But you can use, if you have a good internet, you can be at your home. If you have a from another, for example, from United States, they did a surgery in France. If you have a good connection, you can control the robot from the distance. So it's a good technology and inspiring technology. So my son also, maybe it's the future. I think it's the future of the surgery.
Oh, brilliant. That's really interesting to know. Thank you for that. So that was one of the first questions. I think you've more or less covered it, but how do you use this robotic technique in surgery during urology? How would you use it?
We use for all kinds of surgeries, for kidney surgeries, for prostate surgeries, for bladder, and some masses in the abdomen we can use. It's the advantage is we don't have big cuts with skin
so small incisions,
small incisions, and the recovery is faster after the surgery. The patient less invasive, and patients goes to the home earlier, and so it has some advantages after the surgery, and especially for the prostate surgery, it has advantages of erectile functions after the surgery, because sometimes we have problems after the surgery. For cancer patients, we have erection problems. So if you use nerve sparing technique and the 3D technology, the robotic surgery, the patient will have most probably having good erectile function after the surgery.
Oh, that's really interesting to hear. Thank you for that. Okay, right. Let's go to our second question, Professor Eskicorapci. Let's have a look. Kidney cysts and masses. Explain a little bit about what they are and what the differences is. Kidney stones and masses, are they the same thing, would you say? I think we've probably lost Professor Saadettin there. Let's have a look. Right, we're just waiting for Professor Eskicorapci to come back online. I think I've probably lost him there through a live stream. Probably the internet's gone down or something. We'll just hold on for a little bit just to see if he comes back on. Hopefully we'll get him back on shortly. Looks like we've lost him for a little bit. Let's just hang on there, people, just see if he comes back on. Just bear with us a few moments. We've just got some people in the background there doing connection issues. So just bear with us one moment. It's my last and final show, and can you believe it? It hasn't happened throughout 7 of my series, and now on the 8th show, my final show, I lose one of my guests. Typical. Never mind. Just bear with us a moment. We'll try and get him back for you guys. Just bear with us a moment. Good old internet. I think we're trying to get him back. So just bear with us a moment, people. Sorry about this. Just bear with us. Whilst we're trying to get Professor Eskicorapci back, let's just talk about health in general and about kidney stones and masses. If there's anyone experiencing any problems, obviously, especially during lockdown, obviously to sort of like get an appointment with a GP if they can, or do like a FaceTime consultation. If you're experiencing difficulties passing urine, or severe back pain, or problems going to the toilet, opening your bowels, obviously that is something to think about, and obviously contacting your GP or your doctor. And obviously it's really important that we move around, we keep active, we drink plenty of water, between 3 to 5 litres a day if possible, just for overall kidney function and liver function health. That's really, really important. And also diet. Obviously, we know that the fast food chains have reopened, like Kentucky, McDonald's, Nando's, whatever you want to call them. So obviously to try and stay away from processed foods as much as possible, and just keeping active, eating home cooked foods, your vegetables, your fruit, you know, your probiotics, because they're imperative as well for kidney and liver function as well, and obviously for bowel health and prostate health. So keeping active and stuff like that. I'm just getting some messages coming in. What symptoms should I be checking for prostate cancer? Well, there's a few things actually. Professor was going to answer them for us. We're just trying to see if we can get him back on. Michael Woodland, just bear with me a moment and I'll be with you. There's loads of things you can think about. Obviously the swollen tummy, passing, going to the toilet, opening your bowels, passing urine, going to the toilet a lot more often, not being able to hold your urine, and obviously finding that you need to make more frequent visits to the bathroom, swollen belly, both obviously in a man, it's obviously swollen stomach. That's another thing. Let's see if we can get a skip. Professor, you're back. We lost you. Sorry, I was trying to answer.
Sorry, my internet.
That's okay. Don't worry. I have some patients who want to ask some questions. What symptoms should I be looking for prostate cancer? That's by Michael Woodland, one of our regulars who's on who watches the show. He's I think in his 70s. What should he be looking out for prostate cancer?
I am giving prostate cancer lecture for medical faculty, medical students. So the first thing I have I'm saying about prostate cancer symptoms, it's mostly asymptomatic.
Okay,
so the most important. So you have to go to checkup.
Okay.
When you are normal, not
when
with symptoms.
Is there any age we should be looking out for, Professor? Like what age should
after 50 years of age, every man with symptom or without symptom have to go to doctor and do the blood test and examination, maybe MRI. If you have symptoms like urine symptoms or erectile function symptoms, it can be from prostate, but it can be too late after the symptoms.
Okay. And what about especially with men? I know after the age of 50 they visit the toilet a lot more, other than diabetes, obviously, because that can cause a urinary thing as well. We're going to the toilet more often.
Prostate cancer have mainly symptoms of urinary symptoms. It's just like you said, nocturia mainly, frequent urination. During the night. Maybe the ladies, the wives, and maybe they can notice and warn them about the nocturia. If it's more than 2, they have to visit doctor, not for cancer, but for general health. And maybe the second symptom will be frequency during daytime. It's more than if the patient, the man can feel about the discomfort about the frequency. We don't have
it's the heavy feeling, the heavy feeling, wanting to go to the toilet, the urge to go to pass urine.
We don't have an ideal number of frequency, number of urination during the daytime. But if the patient, the man, the person feels uncomfortable about the frequency, they have to go to doctor.
Okay.
For example, sometimes patient can have dysuria, the pain when urination. It can be a symptom of prostate cancer, and it can be a symptom of passing stones. It can be a symptom of infection. So it can be mixed with the other diseases. So maybe the simple urinary analysis in family practitioner. After that, and blood tests. After that, they have to go to a urologist.
Yeah, and how often should they get checked out, Professor?
Every year.
Every year
once. Once every year.
Mr. Woodland,
after 50 years of age. There's an exception for that if they have a prostate cancer in their family. For example, father and uncle or brother have prostate cancer, they have to go after 45 years of age.
45 years of age.
Yeah, we have to start the checkup early.
Okay.
And there's one exception: if in their family, females with breast cancer and cervical cancer, if they have a family member, so
they have to do more regular checkups.
This is an increased risk for prostate cancer. This is an interesting information. In females, if you have a relative, for example, I have for example, sister having breast cancer, and so my prostate cancer risk also increases.
Oh, I see. So okay, so if you've got a family member,
genetic susceptibility, for example, BRCA.
Yeah, I understand. Okay, that's fine. Okay, we were talking about kidney stones and prevention. What can we do to prevent kidney stones and how do we prevent them from happening?
Yeah. If somebody has kidney stones, it means that that person can have kidney stones during the lifetime.
Okay.
So the man or woman have to do something. The first thing is to have enough water every day. What's the meaning of enough water? It changes for every person, but I roughly say to my patient, you can calculate as 30 multiplying your weight. For example, you are 50 kilos and you can multiply with 30. It's 1.5 liters of water for every day. So it's an ideal calculation for ideal water supply for every day. Consumption, yeah. So you can calculate like that. And the second thing is lemonade, lemon juice, and can prevent urinary stones, especially calcium stones. And the kidney stones are over 90% is calcium stones. So you can, if you drink 2 lemon, you can squeeze 2 lemons and drink every day. You can prevent coronavirus, and you can prevent because it has C, vitamin C. Yeah, it's a good for your immune system. And it has citric acid, and it can prevent calcium stones. So it's lemonade and lemon juice is good for your
without sugar. Yeah. Okay. Cool.
Yeah. Without sugar.
Without sugar. Absolutely. Okay. Men's health in the new era. Explain a little bit about that. That's your 5th question.
Yeah. I think it's very important because we are getting older and older, and the new men, the men's health are getting important when you are healthy, not when you are sick. Because most of the men, just like me in my age, I'm 48, so have to be and trying to be healthy and trying to do something when I'm healthy, not I'm getting sick. So the first thing to be healthy is to move. Please
keep active. Exercise.
Keep active. Exercise, and I'm walking, for example, at least 6 kilometers a day. It's the first thing. You have to move because our evolution, our body needs moving.
And to sustain muscle mass and bone mass.
Yeah. If you want to decrease the insulin resistance, you have to move also. If you want to decrease your cancer risk, you have to move. It's scientific data. It's nothing something sexy, not sexy information. It's a scientific information.
Absolutely.
If you walk more than 6 kilometers every day, so
you will have 10 years onto your life.
You can decrease your cancer risk. You can improve your cardiac health. So you can improve everything, every parameter.
Muscle health, bone health, organs as well.
So every man have to give notice about this thing. So they have to move and they have to walk. The second is keep active, and you have to give importance about your diet. And we have a good diet. The Mediterranean diet is a miracle thing. And every day we have good information about the Mediterranean diet. So you have to cut the red meat, you have to cut the oils, the bad oils, and you have to increase the vegetables. So you can improve the diet. I'm not giving it in details. It's
Yeah,
not
of
the
course, yeah.
topic of
You
this
can put it
program.
underneath when the show is finished. You can put like a little thread underneath to sort of what to follow. So that'd be interesting as well.
So you have to be careful about your diet, the second thing. And the third thing, you have to be careful about your psychology. So you have
Mental
to
health.
mental health. So you have to have some good social life. Good
Mindfulness,
social
yeah.
life. Yeah, it's a scientific data. We have scientific data about social life. If the man has good social life, he has the longer life and healthy life,
Happier life.
and the men's life also is better for
Yeah.
social people. So if some man walks regularly and improves the diet, just like Mediterranean diets, and having more vegetables and decreasing the insulin resistance and more social life and not retiring early, for example, and doing
Keeping
something,
active, gardening,
keeping
walking,
active and
fine
good
as well, yeah.
psychology, he will have a good life, longer life, healthier life. Also, sexual life will be better. This is
Yeah,
scientific
absolutely.
data.
Yeah, that's true.
So the
That's
men's
very
health
true.
in new era means roughly just like thing.
And cutting back alcohol and smoking as well, because they affect our
Yeah,
organs, don't they?
smoking, sure. Alcohol,
In
if the
moderation.
yeah, it depends on the duration and the size of your consumption. If you have a
Yeah,
one glass of wine every
it's
day or
okay.
the day after, it's not big problem. But if you are drinking more, yeah, you can have problems in longer periods.
Yeah. Have you seen patients, Professor, where you've seen people who've been alcoholic who have more underlying issues with their kidneys and their liver than people
Yeah.
who have not? So if it's more dominant if
If
you smoke or drink.
alcoholism, yeah, it's a big problem in longer periods. So if you have a problem of alcoholism, you will have a big problem in your kidneys, and if you will have a big problem in urine and mainly the erectile functions, men's health, you will have a big problem in longer periods of time.
Okay, that's
You
very
have to cut,
interesting to
and
know.
it's and with smoking, it's obvious because smoking will cause
More damage.
micro vessel damage. So
Damage,
it's
yeah.
it's the first thing. The micro vessel damage will give harm firstly to the penis, because penis works with micro vessels for erection. You have to the body will have to fill the micro vessels in penis to get erection. So if you have a problem, if you smoke, you will have a vessel problem. So you will have an erection problem.
Okay, that's very interesting. Okay, right, so we've done that one. Our sixth question of the evening, it's kind of like we're coming to the end. We've got like another 8 minutes or so. Chronic cystitis and reoccurrence in women, preventative measures. So this is one for the ladies. So let's talk about cystitis.
So it's a
What
big
age? I mean,
problem.
any age, obviously it's dominant. What can you give advice on to any ladies
Yeah.
watching tonight?
I think mainly we have two groups of ages, premenopause and postmenopause. Let's talk
Yeah,
about
okay.
premenopause
Yeah.
and these younger ladies, maybe
Yeah.
not married or not having child. The main thing is the simple things are important. For example, what you do for hygiene, vaginal hygiene. I see some ladies, they are very curious about hygiene. Yeah,
Okay. OCD.
OCD. Yeah, so they are using jellies and some medical things. But you have a flora over there, microbiota. We say
Microflora, yeah.
microbiota. So microbiota,
Microbiomes.
they are good bacteria,
Bacteria that you need,
and you
that's right.
are killing your gut good bacteria because they are your soldiers for the
Protection.
protection from the outside.
Yeah, that's
If
right,
you
yeah.
use some jellies, some products to prevent to clean up your
Yeah.
your
Hygiene,
genitals,
yeah.
you are killing the preventive bacteria. Your
You're destroying the
friend.
pH
Yeah.
level.
So please don't use. Maybe after the shower you can use outside, from only outside the genitals, not inside. Please don't use. first thing I said to my patients is that, and you please use 100% cotton underwears. It's very
Oh,
important.
cotton underwear. Yeah, that's important.
Yeah,
That's right.
preferably
Yeah.
white ones, not colored
Okay.
ones. If you have a
Okay.
good brand, you can use the colored ones, but you must prefer white ones, because if you have chronic cystitis, or if you have cystitis more than twice in a year, because it's a problem. We are if some woman having cystitis 1 or 2 in a year, it's normal, not so big problem. But if it's more than twice, it's a big problem. So
Okay.
you have to be careful about drinking water, because if you drink less water, you are susceptible to infection, especially cystitis.
And your kidneys don't function properly
Yeah,
because they
yeah,
become
yeah.
deprived of
Yeah, it's
dehydration,
connected.
obviously.
It's connected. Cystitis and kidney function connected. So if you drink less water, you will have kidney problems, also cystitis. And you have to be careful about the hygiene of your house and your toilets. And also you have to upgrade your immune system. For example, if you have problem with vitamin D, you have to.
Vitamin D.
Yeah, vitamin D is very important because it's good for
Immunity,
your
resistance. Yeah.
immunity. If your immunity get decreased, you can have easily cystitis infections. So I offer my patients drawing blood every year, especially after winter. For example, these my
To check
March.
the vitamin levels.
Yeah,
Yeah.
because it's not just like it's vitamin C, for example, it's water soluble, and you have to take every day from lemon, or you can have products. But vitamin D is lipid soluble, so it can be stored in the body. If you have to take tests about the levels. If your level
Every
is
120 days, isn't it? When you replenish every 4 months, if I'm not mistaken. So three
yeah,
times a year. It's
at least
important.
once, but you can have 2 or 3. I am personally having 2 times every year.
That's
After
good.
winter and after summer, I'm
Yeah.
checking my vitamin D levels, because it's important, especially important in these times for COVID also.
Yeah,
And
exactly. Vitamin C and
every
D,
kind
and
of
obviously
infection.
yeah, it builds up immunity. I think the science is proving that now, actually, to be fair. It's quite
Yeah,
interesting. Professor
we have a good,
Eski,
very big study in Turkey about the
really?
COVID patients. We have about the vitamin D. I think you will be hearing in 1 month about the
Okay.
vitamin D is good, how it's good for infection and COVID also.
Oh, that's really good. That's really important anyway. Just on the subject of cystitis, because I know that there's going to be a few ladies who are watching. What happens when a lady gets reoccurring cystitis more than twice a year? How is it treated? Because we was going to talk about antibiotics, because we can't always give antibiotics all the time, because then it becomes non-existent to the body, because your body's got too many antibiotics, so you can't fight the infection. What would you do in these sort of cases, Professor?
The most important thing is maybe as a lady, you will go to the family practitioner or maybe gynecologist. But if you have a recurrent cystitis, you have to go further. Maybe a good
Or
urologist.
diagnostic work,
Yeah,
urology,
yeah.
yeah.
And you have to be diagnosed in detail. So I offer the ladies to go to urologist and getting the analysis in detail. The most important thing, the big problem is antibiotic resistance,
Okay.
because most of the ladies having antibiotics for cystitis, but they are useless because they have resistance to that kind of antibiotics, and you cannot most of the time you cannot measure about the resistance, because if you have urine culture, but they are not showing, because for example in Turkey, for example ciprofloxacin, it's the most well
Trimethoprim
known.
and stuff like,
Yeah,
yeah.
but if we have 50% resistance, it means
Okay.
in 1 and 2 patient, it's useless. So you have to
Okay.
consult a good urologist about the antibiotic resistance, because most of the ladies think that they are having treatment, but actually the treatment is useless. So
So they have to address the underlying issues as to why they're getting reoccurrent cystitis and stuff.
it's a fake safety about the treatment, and they will eventually recur, and they don't
Reoccur
understand
again.
about I had the treatment, but I have the recurrence. What's this? So you have to consult a good urologist about this resistance.
Okay.
Antibiotic resistance is very important, especially also in United Kingdom. I think it's 40% resistance for most of the antibiotics.
Yeah, that's right.
Metoprolol also have. It's a good antibiotic, but I think it's 20% of resistance for also the trimethoprim.
So obviously drink the water, the cranberry juice, the antioxidants.
Yeah, cranberry juice I also offer here.
Pomegranate juice and things like that. Things that have got high oxidation, like blueberries, ackee berries, things like that. And obviously diet and lifestyle.
Cranberry is the best, not the blueberry. Blueberry is good for your immune system. The other berries are also good for your general health, but cranberry is especially good for urinary infection. But you can also consume. You have the blueberry. I like the blueberry for my general health and immune system. I use blueberry also.
Oh, that's really good. Thank you for that, Professor. We're about to finish up shortly. You've got about 2 or 3 minutes left. Is there anything you'd like to sort of finish off on the subject for tonight? Obviously, we've talked about the robotic surgery, kidney.
I will talk about kidney cysts because the connection is cut when we are talking about kidney cysts. Kidney cysts are important because after 50 years of age, every one patient in two, 50% of the people having kidney cysts. And the most of the time, over 90% of the patients, it's normal. We don't do anything, no treatment, no surgeries. But in 5 to 10%, they will have infection, bleeding, or tumor inside the cyst. Cyst means a small growth. Yeah, but inside only water.
It's not always malignant, is it? It's sometimes
it's 5 to 10%.
Like a lipoma.
Yeah, we don't do anything. But if you have a family history about kidney tumor, or if you have some other problems, for example, immune system problems or other diseases, you have to check your kidneys, just like prostate, because it's inside. It's not outside, just like our nose. Because if something happens in our nose, we can see. But in kidney, you have. I offer my patients after 40 years of age every year an ultrasonography. It's a simple test for tumors, kidney tumors, kidney masses, and kidney cysts. Over 90% it will be good, no problem. But in 5%, it's crucial to detect the kidney masses early, because you can cure kidney tumors in early stages, but there is no cure after metastasis. So
when it's touched another organ or a blood vessel or something, it metastasizes. That's right. And obviously after stage 3, it goes to a 4, 7, whatever. So it gets a lot worse, and that's when it obviously.
I think I can give this message: if you have something and some problem of kidney in your family, members, please go to doctor without any symptoms and for your checkup especially after 40 years of age.
And absolutely.
Regularly, every year.
Get checked up.
It will be the main message for about kidney cysts and kidney disease.
Okay. Well, thank you for your time this evening, Professor Eskicorapci. It's been a privilege to have you on my show. You're my final guest for the 8th episode. I've had loads of people commenting on my right hand, which is why I sort of glare to the right. I've had people saying congratulations. Somebody called Nihat Tubai, congratulations for a very informative program again, Mekella. We've had Michael Woodland, who follows me everywhere. He's basically said, thanks for your interesting series. Any plans for a follow-up? So hopefully people can follow you and they can follow us. I don't know if I'm going to have any more programs, but I'd like to thank everybody watching this evening, even if it's 2 or 3 of them. I would like to thank everybody, your guests, my guests, for UK, Turkey, and hopefully with everything that we've talked about this evening, you can perhaps, if there's anything people want to ask after the show, because it will go onto YouTube, people can ask some questions and follow you. Is that okay?
It's I'm active on social media, on Instagram especially, but I have
hopefully we can travel to and from UK and Turkey, and we'll be exchanging patients, so that'd be really interesting.
Please come and be my guest. Istanbul is very excited about COVID. It's good. I think I pray for
all of us, everybody. Everybody. Thank you so much, Professor Saadettin Eskicorapci. You've been an inspiration for my program. Thank you for being the last guest on my show. Thank you so much for everybody who's watching. Thank you, viewers. Good night, and thank you. Thank you.
Welcome, we are Bologna, calling newlyweds or those looking for a new bedroom set. Venti 5-door bedroom set is not only glamorous and modern, but has storage inside the bed. This bedroom set was £3,700, now £2,395. Bologna, we are here for you.